Healthier Lancashire team to provide some form of clinical input. Cathy and I coming today is by no chance. We're very much a collaboration together where it's managerial and clinicians together. And that's what I've also seen in the Senate as well. That it's not about different groups of professionals doing things separately. It's about collaboration and working together. The Healthier Lancashire team does have previous experience of large-scale change management. Now, again, as a clinician on my first day with the team, I said, I don't do jargon, I don't understand it. But I'm there with a team of people who do understand the jargon and have the ability to bring that in to enable me as a clinician to bring what I have and match it with them. The Healthier Lancashire approach is around 5 phases that I'm going to bring up in the following slide. And really it's about an evidence-based, co-designed, reproducible way of doing it. The key thing for me is about co-design, because I can't stand up to here and tell you what Healthier Lancashire is going to do. We have no hypothesis as to this is what we're going to do, which is a bit of a strange place to be, because usually we're used to hearing what the plans are for something, but I can't do that. So this is basically just demonstrating the phases that we're going through. It's very much business and non-health, which to me as a clinician seems odd, because I've always said that health is different to everything else. But the advantage of using this is we can make sure that we stay on track and make sure that we do the right thing for our patients. As a clinician, as a care professional, we learn what to do differently to how it's done in business. And what we want to do is take the key elements of business out of it and apply it to this change programme. We're very much up at the top still at the moment with the feasibility and developing the foundations. And when we come down into the exploration phase, that's where we as clinicians and care professionals are truly going to be able to be in a place where we can say, actually, maybe we do it differently. Maybe the way we've always done it is not the right way. Maybe we could learn lessons from elsewhere. So, Sean, you brought up a point before about how do you make sure the people involved aren't bringing in their own agenda. And it's about that collaborative working for the right solution for Lancashire. One of our key things that we're doing is developing an identity about Lancashire. Sometimes we feel we get forgotten about. We're in between different places, we're not an island, and it's about making sure that the people of Lancashire have that identity, but also we as healthcare givers within Lancashire feel empowered to step up to the mark as well. The work streams that I mentioned there, one of our work streams is about cultural transformation. It's not about health, our change programme, it's about everything that's to do with patients and people within Lancashire. So in a way, it's a failure if someone in Lancashire becomes a patient. We want to try and bring in that preventative agenda as well. If we don't do something, it's all just going to go wrong and we're doomed, I tell you, doomed. We produced a lot of information in the purpose document that Cathy alluded to that was saying why the people of Lancashire are so unhealthy, what's wrong, and it's interesting. Lots of people stepped up and said, we don't like that. That's painting a very negative picture. Where's all the positive aspects? Why are you making us feel like Lancashire's a bad place to be? And I think it's a way of making sure that we truly understand what the problem is and we don't stick a finger up in the air and just make a change on a whim. This is a bit of a small slide, but it's coming out, obviously, as part of the pack. And there's some key deliverables that we're going to get by working together as Healthier Lancashire. Again, it's just the top one that I'm going to mention about the co-designed, gold standard, evidence-based process. Again, it's technology, it's words, but it's the key thing to what we're going to be doing. The co-design is everybody. So that's patients, carers, users, clients, staff, commissioners. That's why I can't stand here and tell you what changes we're going to bring in. It's not a hospital reconfiguration project because we've not done the co-design phase yet to find out if our hospitals need to be changed. The gold standard, because we've got evidence from other areas that have used this approach, so down at Torquay, Devon, North London, a variety of different places where they've used this and we've learned from their systems as well. Our timeline, we're very much over, oh, I'm on a radio mic, so I'm all right, this side here, and I'm coming back, don't worry. And we're working our way across. What I would draw you is on this side, our procurement, contracting and delivery phase is August 16 to March 20. It's a long-term programme, this. It's not a quick fix. And again, we're very much in the business of having a quick fix, sit, have a meeting, make a decision, make a change, good, move on. We want to make sure that the changes that are made are sustainable and that the interdependencies are all thought through. The key phase where we'll be looking for engagement from the Senate is in the design phase. Within that, we've got developing quality standards that we've heard about already, but also about the care models components that I'm going to come back to. In the governance phase, or in the foundation phase where we are at the moment, we have a variety of different governance groups. These are there to make sure that we have the authority and the buy-in from all the various different constituent organisations. We cannot go out to every single member of our 1.5 population and make sure that they're involved at this stage, so we're using representative groups to do that. The idea is then that we're doing it together so that we can make sure that, if you like, key strands have not been missed out. So whilst there's not 100% representation yet, it's key leaders that are involved. People have said that they want to become involved with Healthier Lancashire, and again, the email address is part of the pack and it will come up as the way to get involved. But we're looking at two different things where we'll be hoping to get the support of Senate members. In our main programme, in the middle box there, it's a bit small and green, I know, is our care quality group. So that's where we're looking for a group of clinical and care professionals who will provide that sense check for us. Is it going to be the right thing? Is it workable? Is the finance available for it? Is it the right thing looking at the other interdependencies? And this might be something where we see people from out with the Lancashire area providing that critical friend support. And again, we see the Senate as having that benefit of difficult geography. Further down at the bottom, I'm coming back, is our care professionals group. Again, we see the population from the Senate coming in there because that's where we expect our care professionals, clinicians to come together and say, in the world of diabetes, we've done this, but what we've really wanted to do is that. So we're setting up a variety of different care professionals groups and work streams to go through and say, within Lancashire, we could do this differently. We've always wanted to do this, but we've never had the ability, the support and the governance behind us to be able to address it and bring it through. We also have that cultural transformation group that I've mentioned because it's not just about health, and it's about empowering people. And our digital technologies group on the side with the key enablers and about the patient holding their own record. So there's a list of benefits with buzzwords and key phrases that I'm not going to read out to you. But they are really about breadth of benefit. It's not a quick fix. It's not a quick win, and no one's saying it's going to be easy. I stand up here and my difficulty is saying I don't know what it is yet. I don't know the changes that we're going to be making because we've not engaged the people in this room yet. And this is one of our key things that we're doing now. So our pre-mobilisation is getting to the place where we have the governance to be able to do this. As anything, money makes the world go round and we're having to secure resources. The resources are going to have to come from within the system. And so we've got to make sure that there's true value in it, bringing back a point from earlier on, and doing it right rather than just doing it quickly. Really come June onwards is when we're going to need that clinician engagement where we're looking at developing the care programme board, the care model groups, and then it's an intensive piece of work through when there isn't much time to do all the groundwork that we're looking at the moment.